on scarlet fever. So I'll be talking about group A Streptococcus, which is the bacteria that causes scarlet fever, how it impacts children's age 3 to 15, symptoms, diagnosis, and treatments/preventions. So group A Streptococcus is the main bacteria that causes scarlet fever. It has a subunit called Streptococcus pyogenes, as seen on the images. They're swirly, S-shaped, tiny dots-like structures. Streptococcus pyogenes like to colonize either the throat or the skin. The primary site is the pharynx, as seen on the image, these three places. It can cause the infection of the pharynx, which is called pharyngitis. Whenever something has itis at the end, it usually means infection or inflammation of the area. It usually impacts children's aged 3 to 15 because of school environments and such, just like COVID. The bacteria releases cytokine, which causes release of exotoxins, thus causing rashes and fevers. Common symptoms. Initial symptoms include fever, sore throat, headache, nausea, and vomiting, which are similar to the flu. But after 12 to 48 hours, a rash forms on the trunk, which has a characteristic texture of sandpaper. It spreads from the chest to the other parts of the body, but it avoids spreading to the face. It's more prominently found on the folds of the skin, the neck, groin, and elbow areas. It's associated with Pasquia's lines, which are dark red lines found particularly in the skin creases or folds of the skin. If symptoms resolve within a week, peeling of the skin occurs, which is a common symptom many people have experienced. Additionally, I'd like to add that there's a 2 to 4 day incubation period before any initial symptoms occur. Before any severe symptoms like sandpaper rashes occur. Initial symptoms will occur throughout those 2 to 4 days, where bacteria will try to grow and attack. Major symptoms. So, swollen tonsils occurs, which then will cause a white coated tongue to occur, and then a strawberry tongue, which is a huge characteristic of scarlet fever. Swelling of the lymph nodes also occurs, which is the ones located in the neck region. Circumpolar pallor with flushing of the face, which is paleness around the mouth region and redness around the face. It's important to know this redness is not a rash. If it were, it would be a different disease. And enlarged tonsils, as seen on the image. Enlarged tonsils can become red and sore, which can cause swelling to become painful. As seen on the image, a normal and an abnormal with swollen tonsils can make a huge difference. Complications. If left untreated, the bacteria can spread to the tonsils, skin, blood, middle ear, sinuses, lungs, heart, kidneys, joints, muscles. A few examples of these are early complications and late complications. Early complications include otitis media, which is the inflammation or infection of the middle ear. Sinusitis, which is the inflammation of the mucous membrane, which is the lining of the nose. Mastoiditis, which is a serious bacterial infection that affects the mastoid bone behind the ear. Late complications, if ignored, it can lead to rheumatic fever, which is a serious inflammatory disease that can affect mainly the heart but also joints and the nervous system. PANDAS is associated with group A Streptococcus. It can cause children to experience obsessive compulsive disorders and tic disorders. Diagnosis and investigation. So just like COVID-19, there's a rapid antigen detection test made for scarlet fever, which checks for Streptococcus, yeah. Clinical diagnosis, which requires you to go to a medical profession, will check for a throat swab, which checks for Streptococcus pyogenes. There's one more other test that is available, which is the ASO antibodies test, which doesn't necessarily check for scarlet fever, but it looks for complications of scarlet fever and responses to the levels of endotoxins released by the bacteria. But the best thing you could do is just seek medical attention, as I said previously, where they would do a throat swab to check for Streptococcus pyogenes. Treatments mainly include antibiotics, such as penicillin, macrolides, or amoxicillin. There are a few alternatives to these two, but these are the main ones. You shouldn't use medicine without the knowledge of them, because certain medicines can make the bacteria, super bacteria, as seen in this image down here. Increased fluid intake, bed rest, and other normal treatments are also helpful. You can notify public health in certain areas like UK. You should, since it's mandatory, but in places in North America, it's not required. Preventions to limit spread, just like COVID, you should wash your hands, not share food or utensils with classmates or friends, cover your mouth and nose if coughing or sneezing. Okay, for the part 2 of the Scarlet Fever presentation, I'll be talking about risk factors, source, long-term effects, severity, history, and current status. Risk factors. The most common risk factors is close contact with other people with scarlet fever. Since it takes 2 to 5 days for major symptoms to arise, which is the incubation period, scarlet fever can spread unbeknownst to the infected person, like COVID-19. Most common sources of scarlet fever are from group gatherings, such as school gatherings or daycare centers. Since scarlet fever is spread by droplet infections, just like COVID-19, it enters through the mouth, nose areas, or eyes. Thus, since COVID-19 allows us to wear masks, it's a good idea too. Long-term effects include abscences around tonsils, which is the painful collection of pus if left untreated, rheumatic fever as mentioned before, pneumonia seen in the image below, arthritis, and a kidney disease called PSGN. Severity. Scarlet fever is less common and easy to treat than it used to be. The severity has decreased drastically with the help of antibiotics. Before antibiotics were created, though, there was a death rate worse than 15 to 20%. With the antibiotics now, it's only about 1%. The history of scarlet fever. There was a world pandemic of scarlet fever and severe epidemics in the 17th and 18th century of Europe and North America. The name Scarlatina came from Thomas Sedenham. I don't know how to say that exactly, but in 1670s. In the 1920s, Georgian gladiators created a vaccine. Antibiotic therapy was created in the 1940s. Before antibiotics, people would be quarantined, just like COVID-19, and a sign would be put on a person's house indicating there is diseased people with scarlet fever, just like the Black Plague. By doing this, they hoped it would stop spreading. The current status of scarlet fever. Scarlet fever is still around, although the numbers have drastically dropped. But in recent years, there have been outbreaks, such as in South Korea, Vietnam, China, Hong Kong, and other places. No one knows the exact reason why. Bibliography, if anyone would like to know where I got the information.